Oh, you look like you've just gone 10 rounds with Ricky Hatton.
Oh, it's nothing that a hot bath and a couple of hours sleep won't put right.
Well, you got the afternoon off, nothing to stop you.
No, believe me, there is. Oh, my mother's coming to visit.
Is that good or bad?
Well, on the one hand, it would be nice to catch up.
But on the other...
Oh, I'll give it 5 minutes before she starts giving me a hard time.
That sounds familiar.
Yeah. And she's come to help with the gardening, so this time it'll be because I'm using the wrong sort of twine, or because my gloves don't match my outfit.
Oh, I'm sure her heart's in the right place.
Well, medically speaking, it is. It's my last patient here.
Oh, yeah, straight from charm school.
Oh, now, do you believe in reincarnation?
Oh, yeah, apparently I used to be a pussycat.
Oh, right, because Becky Lou Bradshaw, she come back as a Rottweiler. Mrs. Bradshaw, Candice, how are you?
You late.
Yeah, sorry about that. Do you want to come through?
Come on, you.
Right, so how are we today?
It's Madam here.
Okay.
She's got bad guts.
I'm all right.
Not first thing this morning you want. Yowling like a cat in a tumble dryer she was.
The pain's gone now, all right?
Well, I may as well take a look now that you're here.
I'm okay, really.
Have Mr. Morning's work to drag you down here.
Well, no one said you had to.
Can't trust you to do it on your own, can I? Now do what the doctor says.
So, where did you feel this pain?
Right here.
And it's gone now, you say?
Yeah.
Okay, well, let's just check your temperature. You been eating okay?
You saying I don't feed my daughter proper?
No.
We eat decent food. Oven chips, not fried.
Been any change in your diet? Not been for a curry, anything like that?
She don't like spicy food.
Mrs. Bradshaw, would you mind letting Candice speak for herself?
You saying I don't know my own daughter?
No, of course not. I just think that we stand a better chance of finding out what's wrong with her if we let her tell us what's wrong.
I thought that were your job.
Perhaps it'd be a good idea if you waited outside.
Why?
I need to examine Candice.
Why can't I be here while you do that?
Will you just do it, Mum?
I'm going outside for a fag. Don't take all day. I need to get back to work.
Okay, your blood pressure's a little bit low.
Is it bad?
Not necessarily. Did you get period pains?
Ugh.
Sorry, there's no need to be embarrassed. Loads of women do.
No, I don't.
Okay, so we need to look at some other possibilities.
Like what?
How old are you?
16 last week.
You got a boyfriend?
No.
So there's no chance that you might be pregnant?
My mum would kill me, so...
Well, it's perfectly normal for a girl of your age. Do you have a boyfriend?
Oh!
Candice?
It's come back here.
Look, are you quite sure about not being pregnant?
Look, I told you, didn't I? I've never even done it.
Okay, I think you need to go to the hospital.
Why? What's wrong with me?
Look, it's probably nothing to worry about, but I would be happier if they would take a look at you and then put both our minds at rest.
What does my mum have to know?
Oh, my lips are sealed.
Thanks.
You sure there's nothing you want to tell me?
No.
Okay, we're going to need you to do a urine sample, so if you just pop to the ladies and fill this up for me.
Do I have to?
Please.
Right.
Hi, can I have the gynecology department, please? Yeah, I'll hold. Hello?
Where are you?
I'm at work.
You should be here.
We said lunchtime.
It is lunchtime.
Well, I'm still at work.
You knew I was coming.
Yeah, look, Mum, I'm really busy. I'm going to be another hour or so.
An hour?
Yeah, let yourself in. There's a spare key under that blue ball thing.
Nellie, you might as well have written burglar's welcome on it.
Okay, look, Mum, I'm really, really busy. Just let yourself in, make yourself at home, put the kettle on, put your feet up. I've got to go. Bye. Hello? Yeah, hi, this is Dr. Bell from the Mill Health Centre. Well, I've got a 16-year-old girl. She's suffering with abdominal pains and I think she might be pregnant. Is there any chance you can get her in for a scan today? Oh, that's fantastic. Yeah, her name's Bradshaw. Candice Bradshaw.
Where is she?
She just popped to the loo. She's back in with the doctor now.
This is ridiculous. Is she going to be much longer?
I really don't know.
You're new, aren't you?
Yeah.
Hope you're better than that stuck-up so-and-so that used to be here. Face like a bulldog, chewing a wasp, that one.
Take this to reception and they'll sort you out.
Cheers.
Did you get a sample for me?
No, I couldn't go.
Candice.
Well, I'll do it at the hospital. Mum won't be worried where I am.
About time. They'll dock me wages, you know.
Yeah, thanks for caring.
So what's wrong?
I'm still not sure.
And that's it, is it? You're just going to sling her out on the street? Dr. Fenton would have known what was up.
Mum, will you leave it?
I've discussed some options with Candice.
Which are?
I'll leave her to tell you.
Thanks for nothing. Come on, there's a bus in 5.
Now I know what hurricane victims feel like.
She's a challenge, that's for sure.
Ooh, you don't go past the campus, do you, on your way home?
Can do, yeah.
It's just that Julia rang her. She needs some files and she can't get away. I could run over at lunchtime, but if you're passing...
No, it's okay.
You sure you don't mind? It's your afternoon off.
It's all right. I'm sure Mummy can wait another 10 minutes.
What did she say then? Nothing. Took a long time saying nothing.
Just leave it, will you, please?
I don't know what's up with you.
Neither do I.
Oh, give up. Get yourself home and go to bed.
It's the middle of the day.
It's what you do when you're ill. If you're ill. Either way, I'm not having you roaming the streets.
I wasn't gonna.
Good. I'll see you when I get back. Home.
All right.
Oh, hiya. Isn't your mum coming today?
Karen said you wanted these.
Oh, thanks. Everything all right?
Oh, we'll find out soon enough.
You know, someone might think that you're looking for an excuse not to go home.
Someone might be right.
OK, how about a cup of tea?
How busy?
Not. Anyway, Ruth left a very impressive stash of biscuits.
How is she?
Well, I went to see her at the weekend. She's just like this little lost thing, really. I'm just going to wrap her up in my arms and hold her really close, you know? Yeah, well, you know, when you've had your perspective changes, you'll find that out one day.
Just as long as I don't end up like my own mother.
Oh, you probably will.
You're just depressing me now.
She can't be that bad.
Well, she's not in the Becky Lee Bradshaw League, that's for sure.
Oh, she's favoured us with another visit, has she?
With her eldest, Candice.
Suffer from earache, no doubt.
Not sure what the problem is. I've sent her off to St Phil's for a second opinion. Just got a hunch something's not right.
You see, that's good, backing your hunches. It's half the battle of being a good doctor.
I think Becky Lou thinks I am.
Yeah, well, dealing with Mrs. Bradshaw is kind of like a rite of passage. It doesn't kill you, makes you stronger.
I'll remember that.
Right, so what about that cup of tea then? Plus a very nice all-butter shortbread.
No, I'd better be getting back.
OK?
Thank you. What are you doing?
Hello, darling. It's lovely to see you too.
Sorry. Sorry, I've had a bit of a hectic morning.
When did you last clean this oven?
Yeah, it's been a while.
So I see. I was about to put some potatoes in to bake. You don't seem to have much food in the house.
I do now.
Organic?
Cup of tea?
I just have one, thanks.
Tea for one it is then. I thought that we could have some lunch and then get started.
I bought some bedding plants.
You didn't need to.
And Derek insisted I bring some horse manure. It's well rotted.
Derek.
Oh, Derek's our new gardener. Well, I say new. We've had him for a few months now. But then, you don't visit as often as you used to.
No, sorry, I just don't seem to have any time at the moment.
So I see. Pansies and primroses. Derek's brought them on in the greenhouse, but they should be fine to plant out now that the frosts have gone.
They're very pretty.
I hope I brought enough. Your father said I should bring more.
How is he?
Infuriating. Relentlessly cheerful, same as ever.
And JJ?
He's coping.
Good.
Putting on a brave face, like he used to when he fell off his pony. He used to come to me for a cuddle, then straight back on again.
That was when he was 7.
Still needs his cuddles, though.
Oh, don't we all?
Shame he couldn't come to me when it all went wrong.
I'm not sure it would have helped.
Might have been nice to have the opportunity to try. These violas are gorgeous, don't you think? And not so fast. We need to prepare the ground first. Derek was most insistent. We need to dig in the manure, fertilize the soil.
Yeah, of course. I mean, if Derek says so.
There's some bags in the car.
Well, won't it take 2 of us, do you think?
My back's been playing up again. Be careful. They're heavy.
Don't use that in here.
I'm only texting.
I don't care what you're doing, just put it away.
Please?
Please.
Oh, how much longer is it going to be anyway?
You'll have to ask at reception.
Yeah, I did, they don't know.
Then neither do I. Mrs. McComb. This way.
Here, let me help.
Are you okay?
I shouldn't lift things, really.
Do you want me to take a look?
I'm seeing my osteopath tomorrow. No one knows my lumbar region like he does. Oh, be careful. You'll get it everywhere. Look, I'll put the kettle on.
Candice Bradshaw. Candice Bradshaw.
No need to shout. I'll put it on silent.
Off.
Right?
Thank you.
You're welcome.
So, you're pregnant?
No.
Well, your GP seems to think that you might be.
Yeah, well, she don't know nothing.
So you're telling me you're not pregnant?
What is it with you doctors asking me the same questions all the time? I told her I'm not having a baby. I can't be. You know what I'm saying?
Well, that depends on exactly what it is you are saying. Have you had unprotected sex in the last few months?
I'll get lost.
Is that a yes or a no?
No.
But you have been having abdominal pains?
Yeah, that's what I told her, but she didn't know what were wrong. But she said I needed a scan or something.
Oh, well, if Dr. Bell says you need a scan, who am I to argue? Be a bit of a wait, though.
Look, I've been here ages already.
Yeah, so have I. Since 6 this morning, to be precise.
Oh, is that right? Right, well, why don't I just leave and then you can get home to your nice comfy bed, yeah?
Hang on, Miss Bradshaw.
Well, no, forget it, right? There's only one thing that's going to make me feel sick, and it's hanging around this place any longer.
You can't just leave.
Watch me.
Do you think that's enough?
I hope so.
I didn't realise you had such a big plot.
I didn't realise you were going to bring quite so much stuff with you.
Oh, Derek was most insistent.
That's a shame you didn't bring him with you. Or a mechanical digger.
The exercise will do you good. An antidote to all that work.
If you say so.
Aren't your exams soon?
A few weeks, yeah.
Think you'll pass them this time?
Oh, I hope so.
Any plans?
Look for a job, I suppose, if I get through.
Might they offer you a job at the mill?
There is a vacancy.
There you go, then.
I'm not even sure if I'll take it. I don't even know if I want to be a GP.
After all that training?
Well, it's tough. You get sucked into people's lives. Well, I do anyway.
You've always been a sensitive soul.
Had a girl in this morning. She's barely 16. She might be pregnant. I mean, she might not be. She swears she's never even been near a boy. And she has this mother from hell who will kill her if she has. And every time I try and make a diagnosis, she clams up. And I've got to try and pick my way through it.
You need to develop a thicker skin.
Yeah, that's what everyone says, but I'm frightened.
What of?
Well, I'm scared that if I stop caring, I might stop being able to give my patients what they need.
Which is what exactly?
Care, treatment, sympathy.
So that's why JJ came to you.
I did my best.
Maybe I could have helped. If it came to me.
He did.
It was too late by then, though, wasn't it? That time with you pushed him right off the rails.
Mum, JJ was a train wreck by the time he got here. I did my best.
What do you say so, dear? Where are you going?
You're right, we need some more plants.
Well, wait a moment and I'll come with you.
No, there's no need. I won't be long.
Mum, listen, I've got this.
I don't care what you've got. Where are you?
I'm at home, like you said.
Well, that's funny, because that's where I am and I can't see you.
I'm at the shops, all right? I'm back soon.
5 minutes or you're in big trouble, young lady. And don't give me the silent treatment either, you cheeky madam. Candice? Candice?
Candice!
No. It hurts.
All right, show me. Did you go to the hospital?
Yeah.
And what did the scan show?
I never had it.
Why not?
The stupid doctor was giving me a hard time. I wasn't just going to sit there and take it, was I?
All right, I'm going to ask you this one last time, and I need you to be honest with me, okay? Is there any chance you might be pregnant? Look, this is important. I'm not here to judge you. I am not your mum, but I need to know.
I missed last month. I'm normally dead regular.
Okay. Yeah, any idea when it might have happened?
A couple of months ago, I was drunk. I only did it once.
Once is all it takes. Come on.
Oh, don't take me home, will you?
No chance. I'm going to get you straight back to the hospital. Come on.
Kerry Price.
Excuse me. Sorry, I'm Melody Bell, GP Registrar with the Mill Health Centre, and this is Candice Bradshaw.
Yeah, Miss Bradshaw and I are old friends.
She needs to be seen now.
Well, I'm afraid she's going to have to wait.
No, it's important.
I'm sure, but people have been waiting for a long time.
I insist that you see her immediately.
You come marching into my department, reeking like a barnyard, shouting the odds, and demanding that your patient jumps the queue.
I think that she may have an ectopic pregnancy.
Well, according to her, that's not possible.
Yeah, she may not have been entirely honest with you earlier. She's since told me that she could be pregnant.
Okay, well, she told me she couldn't be, so why should I believe her now?
Oh, abdominal pains, dizziness, her BP was low earlier, and I'm willing to bet that it's right down now. It's all consistent with an ectopic pregnancy.
Oh, I really don't feel so good.
Let's take a closer look. I'm sorry, Miss Price, this is an emergency.
Hello? What do you want? I'll be right there.
Need to be somewhere?
Yeah, someone will be wondering where I am.
Boyfriend?
Yeah.
Clearly he doesn't have a highly developed sense of smell.
You always this charming?
It's been a long day.
Yeah. How's Candice?
Your diagnosis was right on the money. Tiny fetus sitting nicely in the fallopian tube, just about ready to go pop. She's in theatre now, she'll be fine.
She won't be when her mum finds out.
Bit of a dragon.
Lot of a dragon. I've just found her, she's on her way in.
Well, I'm going to leave you to that then, because I try not to have anything to do with ferocious mothers. Well done, by the way. It wasn't an obvious spot, that one.
Hi, I can't come to the phone right now, but please leave a message.
Nellie, where are you? I need to get back to the horses.
What's going on, Candice? And why didn't you tell me all of this before?
I don't know.
But you might at least have mentioned that you've been having sex.
Yeah, well, it's gone now anyway, so
Well, you'll have plenty more opportunities to have children.
I'm not sure I want any. I don't want to end up like my mum now, do I?
Well, they say that we all do in the end, which in my case is a bit of a worry.
I bet yours isn't on your case all the time.
Well, she's a bit more subtle than your mum, but the effect's the same.
Why are they like that?
Oh, I don't know. Because they don't want us to get hurt. They don't want us to make the same mistakes that they did. Because they care.
Yours, maybe.
I'm sure Becky Lou cares about you. You know, in her own way.
Whatever, she's going to go mental when she finds out about it.
You're not wrong there, madam.
What are you doing, dear?
Martin on, I couldn't have trusted you.
Mrs. Bradshaw, your daughter's just had surgery.
Because you didn't spot what was wrong with her in time.
Because she was too scared to tell me she thought she was pregnant.
I warned you what would happen if you went messing about with boys.
And because she was frightened of what you might say.
It's all right.
Look, this could have been serious.
And getting up the duff at 16 isn't.
She could have died. Candice could have died because she was too scared to talk to her own mother. How would that have made you feel? Is that really the sort of relationship you want with your daughter? One based on fear?
Of course not.
And let me get a word in sometimes.
I just want what's best for you.
Well, guess what? So do I. So how about trying to find out what that is?
Do you know what? I'll leave you to it. And sometimes it wouldn't hurt to listen a bit. Might do you both some good. You all right?
What does it look like?
Can you move?
Of course I can. I'm trying to stretch it out.
What's it hurt?
Here.
Sorry I took so long.
I've been worried.
One of my patients had an emergency. I've been at the hospital.
Oh, you could have phoned.
I know.
Ow!
Sorry.
There's a thing my osteopath does. When it goes like this, clicks everything back into place.
Oh, it's not my area of expertise, I'm afraid.
No.
What do you mean, no?
It's just that I need a proper doctor, that's all.
I am a proper doctor.
You don't do backs, do you?
I do backs, and I'm doing your back right now. But just because I'm not an osteopath like your precious Derek.
That's the gardener. My osteopath's called Martin.
Mum, I am 28 years old. I have spent 6 years in medical school, 3 of them in a hospital, and for the last year or two I have been working as a GP. And I have been treating people and listening to their problems and saving their lives. And do you know what? I've actually become quite a good doctor. And I would appreciate it if just for once you could give me some credit and stop undermining me at every opportunity.
I don't.
I know I don't always get everything right, but sometimes I just wish that you would give me some credit when I do.
We've We've always been very proud of you, your father and me.
Well, then it wouldn't hurt to tell me sometime.
Right.
And there's another thing. I am not responsible for what happened to JJ. No, and neither are you. Okay, we both tried our best, and he's still your son, and he's still my brother, but he is a grown man. And I just think that we should let him get on with his life while we get on with ours. Agreed?
Agreed. There's just one thing I want to say, though.
Oh, what?
I know you're a good doctor.
Thanks.
How about something to eat? I'm starving.
Yeah, well, I've been thinking about that.
Frozen vegetables.
No, these are for your back.
Ah.
Once I get cleaned up. Brace yourself, this might be cold.
Ah!
And then I'm taking you for dinner.
But what about the horses?
Daddy can cope.
Oh, I need to make sure he's done it properly.
Well, it's your choice. Snooping on Dad, dinner with your daughter.
I suppose you can manage.
Yeah.
But it's my treat.
Agreed. And, well, I mean, the spare room's made up, so you could stay if you wanted to. You know, we could have a chat, catch up.
Thanks. I like that.
So would I.
Michelle's the best friend I've ever had.
Archie, if you're going to keep banging on about poor little Ruth, go do it to someone who actually gives a toss.
Now stop being a moron and tell Dr. Carter what the problem is.
Ah, this makes it bearable.
Just about blown the Father of the Year award.
Now You See Him, Now You Don't is the death of Mark Sloane's magic coach, an elaborate trick. Diagnosed as murder coming next on BBC1 Scotland.